Now coming to the ligaments of the liver, there are two types of ligaments of liver, true and false ligaments. False ligaments are just peritoneal folds and they are not real ligaments. So false ligaments are of five types again. The one I told you earlier, the falciform ligament present on the anterior surface of diaphragmatic surface. Falciform ligament continues as the coronary ligament. Coronary ligament continues as the right triangular and left triangular ligament. So these four, that is the falciform ligament, the coronary ligament, the right triangular and the left triangular, these four are the true ligaments. And another true ligament is the lesser omentum that you can see on the visceral surface. It continues from the lesser sac of stomach to the porta hepatis. This is the lesser omentum. So these five are the folds or peritoneal folds of the liver, which act as false ligaments. These support the liver. The next one is the true ligament. There are only two true ligaments. uh, these are ligamentum teres hepatis, that is the continuation of the falciform ligament, and the other one is the ligamentum venosum, as that you can see here. Ligamentum venosum is located in this fissure for ligamentum venosum on the visceral side. Ligamentum venosum is a remnant of ductus venosus, which was present in the earlier life, fetal life. And the other one, as I said, the ligamentum teres hepatis. This is the fissure for ligamentum teres hepatis. This is the ligamentum teres hepatis is located here. It is a remnant of obliterated left umbilical vein. Coming to the relations of the liver, first the diaphragmatic surface. The anterior surface is related to the anterior abdominal wall. If abdomen was present here, anteriorly it is related to anterior abdominal wall, and right surface is related to 7th to 11th ribs, as I showed you earlier. Now the posterior surface has is mostly related to the diaphragm, and it has a bare area. Here the bare area is located. Here the groove for IVC. This is the gallbladder. So the diaphragmatic surface is mostly related to the diaphragm. We can't talk about the relations of diaphragmatic surface much, but the relations of the visceral surface or inferior surface is really important. Now coming to the relations of the visceral surface, here we can see the viscera that are related to the liver are mostly on the inferior surface or visceral surface. That's why the name is given as visceral surface. So first see the stomach. So impression for the stomach is present in the left lobe, and in the right side we can see the right kidney and the right suprarenal gland. Here is the impression for the colon, the transverse colon more or less, and this is called the hepatic flexure. So in the right lobe we can see the colon, the right kidney impression, and the right suprarenal gland impression. In the left lobe we can see the stomach impression and the pancreatic impression also more or less, the duodenum. Actually, pancreatic impression we can see directly as duodenum covers it, and we can also see the gallbladder here. So inferiorly we can see gallbladder also. It is present in the fossa for gallbladder. So that's all that is present in the visceral side. The visceral relations of liver are more clearly elaborated in this picture. You can see here the visceral relation of liver. In the left lobe presents stomach, as I have showed you in the 3D diagram. Here the esophagus is present, of course. Esophagus continues as stomach, and hence this is the pyloric part of the stomach. This is the second part of duodenum. As the pyloric part continues as the duodenum, you can see here, if you think like that, it's more easy for you to remember. So this is the esophagus, this is the stomach, this is the pyloric part of stomach, and this continues as duodenum. So below the duodenum, as you can see the colon here, it continues like this. So it's the colon. Right colic flexure is present here. It's also called, if you remember, the right colic flexure is also called as a hepatic flexure. So this is the impression for the right kidney in the right lobe. Left kidney is not impacted here, only the right kidney as it is present in the right lobe. And on the superior surface of the kidney, we can see the suprarenal gland. So impression for suprarenal gland is also present in the right lobe. And you can also see a groove for inferior vena cava. So inferior vena cava is also present. The fossa for gallbladder. So gallbladder is also present. And the most important structure is the porta hepatis, as we talked earlier. One more important thing to be discussed here in the topic of liver is the bare area. Bare area is an area that is uncovered by peritoneum, uncovered by peritoneum in the liver. The one which is present in the posterior surface of the liver is called the bare area, of course. But there are some more bare areas, that is the areas uncovered by uncovered by peritoneum in the liver. These are, the first one is the fossa for gallbladder. Here, the fossa for gallbladder is uncovered by peritoneum as gallbladder interprets this area, and even the porta hepatis is uncovered by peritoneum, but the lesser omentum is surrounds the porta hepatis, but it doesn't cover the porta hepatis. And even the groove for inferior vena cava is not covered by peritoneum, as the inferior vena cava is present in that groove. And the other one is the groove for ligamentum venosum here. The ligamentum venosum groove is also uncovered by peritoneum. So there are five bare areas. One is the bare area of the liver on the posterior surface. The other is the fossa for gallbladder. The third one is the groove for IVC, and the groove for ligamentum venosum and the porta hepatis. So these are the five bare areas of the liver. Coming to the blood supply of the liver, liver is a highly vascular organ. It receives blood from two sources. The first one is arterial blood from the hepatic artery, which is the main artery of the liver. So, arterial blood, that is the oxygenated blood, comes from the hepatic artery, whereas the other blood source is venous blood, which is rich in nutrients, that comes from the portal vein. So the two sources of blood are arterial blood, that is from hepatic artery, and the venous blood rich in nutrients from the portal vein. The most important point is that one third of cardiac output goes through the liver. 80% of this is through the via portal vein, and 20% is via hepatic artery. The venous drainage is through inferior vena cava by hepatic veins, which are right hepatic vein, middle hepatic veins, and left hepatic vein, that are the tributaries of the inferior vena cava. So these are also important in the physiological lobulation of the liver, as discussed earlier. These carry the venous blood from the liver segments. The most important is the nerve supply of the liver. The nerve supply is both sympathetic and parasympathetic. Sympathetic is from the celiac plexus, that's most important for the liver. The celiac plexus provides the sympathetic nerves, and the parasympathetic nerves is by the hepatic branch of anterior vagal trunk. So, the importance of sympathetic plexus or celiac plexus is that it carries pain which is caused due to distension of hepatic capsules or hepatic peritoneum during hepatitis. This pain is generally referred to epigastrium or shoulder occasionally. This is called as referred pain. So, sympathetic plexus is important in carrying the pain due to hepatitis, and That's all. The lymphatics is also important in liver. The lymphatics of liver include superficial and deep lymphatics. Superficial lymphatics are by the posterior mediastinal nodes, celiac nodes, and hepatic nodes, whereas the deep lymphatics includes the lymphatic that occur near the portal triad. There are two trunks, ascending and descending trunk in the deep lymphatics. Thank you guys. Hope you enjoyed the video. Please like, share, and subscribe for more videos. Thank you.